Greetings, everyone. Welcome to the 158th session of the online Optom Learning Series, OOLS. And for today's session, we have with us Dr. Mohammad Nooruz Zaman. He has earned his PhD very recently as a Doctor of Philosophy degree from the Chitkara University. But his journey in optometry began at the Jamia Hamdard University, New Delhi, where he finished his bachelor's and then completed his master's of optometry at the Lotus College of Optometry in Mumbai. He has various publications into his credit, has presented in several national as well as international conferences. His main focus of research is in anterior eye, dry eye, and contact lenses. He is also the joint secretary to and the fellowship coordinator for the Association of Schools and Colleges of Optometry, which is ASCO India. Currently, he is associated with Shankara Eye Foundation as the head of Department of College of Optometry in Punjab, India. He also is very active on YouTube, a channel which is inclined towards skill-based clinical videos, not only for clinicians, but also for patients' care. And he puts up these shorts, 4-5 minute videos on small tests, which we routinely perform, how to perform, what are the indications. So I would definitely, encourage you all to visit this YouTube channel. It's known as Optometry Reels, right?
Right.
That's right. Correct, right. And today, Noor is going to talk to us, being a fellow of IACL, contact lenses being his passion. He is going to talk to us about the use of contact lenses in sports and how can they be beneficial for our athletes. So welcome, Dr. Noor, onto our platform. And, let me just leave the screen time to you.
Thank you. Thank you, Fakhruddin. And hello to everyone who is present on this platform. Today, I'm going to discuss on the contact lens used in various sports. Okay, today we are in the era where we choose sports for various purposes. Some use it for the fun, some use it for the recreational, and for many of us, it's a career option and or the opportunities. But the history of sports in India or across the world is not new. It has been for the various centuries. In the India and the subcontinents, its history dates back towards the Indus Valley civilizations, when the sports like chess, chaturanga, kabaddi, wrestling, or pahlwani were played. But in the today's modern day sports, it has changed drastically. These sports are being played with full passions. They are being opted as a career. So if you see that these sports demands a skill related demands, as well as it also demands visual skills. Some of the visual skills that we as an eye care practitioners can enhance, can improve in the various athletes. So let's see what those visual demands are actually that we take care during our day-to-day practice. That's a static and the dynamic visual acuity. When we perform any test or when we see any athletes, we need to understand the dynamics of their game. We need to understand which sports are they playing. And based on that, we need to give them the specific treatment or measure their visual acuity, or we need to correct the visual acuity in such a way that they should have a good quality of vision, and that can be achieved with when we are giving a very appropriate and the base correction. We have to understand that these players play usually in the various lighting conditions. Some sports are played outdoor, some sports are played indoor. The color, contrast, background, everything are very dynamic and changes. So the vision of the eye should be very accurate and appropriate for them to anticipate the games in order to perform well. Okay, along with that, the study of this peripheral perception and the visual motor reaction times, that needs to be very good. And these all things can be enhanced, or it can be corrected with the right kind of vision or right kind of visual corrections. So what these players, when they are into the sports or when the athletes are onto the ground, so there could be some common problems that they may face, or these problems can be ocular hazards or the ocular problems. And these ocular problems may be because of the poor visual correction or poor eyesight. It can be also because of the facial or the head protections. So some of the facial protection or the head protection can be a problem to the others, that can be a source of mechanical injuries to themselves or to the other. So therefore, the sturdy and the very durable and the right protective devices are important and necessary for these athletes. Many a times, because of refractive correction or because of the spectacles, these players may not be able to use the right protective gaze, because they may hinder their performance. Along with that, some of the common problems could be a temperature and the humidity, which can create fogging of the glasses. And these all things further enhance with the environment variability, because we can understand that these players play in the different conditions, different geographical places. So dust, foreign body, humidity, these all things can be additional problems to them, and that can decrease their performance on their ground, or that can be a problem to their performances. If you see, the study or the literature says that around 55 million ocular injuries occurs. Among all these, 40,000 are actually because of the sports. And you will surprised to know that the 90% of these sports related injuries can be prevented. So how it can be prevented? It can be prevented by giving a appropriate prescription and giving a correct protective devices. So here, as an eye care practitioners, our role becomes very, very important. So as a eye care practitioners, how we can enhance their vision? So there are the various ways to enhance their vision. One, we all know, the spectacle. Other can be a contact lens, and the third option can also be a surgery. So let's talk about the basics, that how we can enhance their vision. So contact lens in sports can be a very vital or the very crucial. Uh, we all know that there are various sports that are played in a different, that have different natures. Some can be a high impact sports, some can involves different environmental conditions, and some can be played outdoor, some can be played indoor. But do you think that all contact lens is a is good or ideal for each and every sport? So we will go through the presentations, and we'll go through the session, and we'll come to know that there are specific decisions that we need to take when we are dealing with these athletes, or when we are giving a dispensing to these sportsmen. So contact lens can be a very ideal and a correct choice for many athletes and in most of the sports, but it cannot be the only choice. It is easiest and the quickest way to improve their vision. That is absolutely correct. And the contact lens are available in the various types, like soft and the RGP lenses are there. In these lenses, there can be a correction. We can use this to correct their astigmatism. We can use to enhance their color perception. We can use this to reduce their glares. So the options and the choices are very much for the improvement of the quality as well as the quality of vision. So whenever we are practicing contact lens for the sportsman, because we can see that everyone are engaged in some kind of sports activities, especially the children. So when we are practicing or when we are looking with the sports related practice, so it will also gain confidence to our practice, and it will also attribute towards practice. So what are the various advantages that we see in with the contact lens when we are dispensing for the sportsman. One is the peripheral vision, good peripheral vision. It increases the peripheral perception. It also enhances the depth perception. Since these lenses are onto the eye, so usually they move with the eye, so there is no chances of popping out or dropping of the lenses out of the eyes. Again, the problems of the reflections, aberrations, or the glares are very, very minimum with the contact lenses, whereas in the spectacles it can be very high. So you can see that these all benefits that we gain with the contact lenses when we are dealing with the sportsman. Also, patient will have a freedom to use the uh, goggles, sunglasses, or any protective devices over the contact lens, whereas it can be a problem to with the spectacles. Again, psychologically, patients are more confident. They usually feel like a real world situation. So we all see that there is an advantage of the contact lens in the sport. So one should be proactively dispensing the contact lens in for the athletes. There are a few things that was seen in the one of the study done by the American Optometric Association when they did a survey, and they found out that the 7 out of 10 children perform better in their sports when they were given the contact lens compared to the spectacles. So we can see that the study says that there is an improvement, there is a benefits of contact lens over the speed, but still if you can see that the proactiveness in dispensing is quite less. People still feel they do not proactively dispense the contact lenses, maybe because there could be various reasons associated with this, lack of knowledge, awareness, uh, uh, and also maybe because of risk involved in the contact lenses. But as a eye care practitioner, if we are aware of the risk, if we are aware of the limitation of the contact lens, I think we can very much be able to manage the conditions. Very much we'll be able to dispense the lenses in the athletes. So a few points before going ahead, we should understand that these lenses are affordable. They are provides a better sports performances. It is ideal for vision correction for any or almost all kind of sports activities. Uh, Remember that this is not only good for the serious athletes, but almost in all conditions. But above all, I mean, if you are giving that, one thing we have to be very careful that even in any conditions, the sportsman or the athletes needs to care and maintain their lenses, because at no point we should compromise the hygiene, we should compromise the care and maintenance of the contact lenses. That's important things with any contact lenses. Also, let's understand that what we need to do when we are dealing with any athletes, when we are dispensing the contact lens. So as an eye care practitioners, we should understand that our fitting or our dispensing should be very optimum. We should tailor our examination. It should not be like we are following the standard pattern of the evaluations. We should understand the needs of the athletes. Okay, so some may require a crisp and clear distance equity. Some sports may demands a good near vision. Some sports may demands a good depth perception. So our aim should be based on their requirements, so that we can provide a good and the better correction. Also, we should understand the nature of the sports. So that is again quite, and that is very important, because different sports may demands a different different challenges may be seen in the different sports. So that understanding is very important for all the eye care practitioners whenever we are discussing, whenever we are dealing with the athletes. Also, let's see that when we are selecting any patients, okay, for the selection of the patients, good and general health is very important. Okay, patients' personal hygiene is quite important. Patient should be motivated to wear the contact lenses. So these sometimes, if patient doesn't have a good ocular health conditions, or patient has a compromised ocular structures, we should try to avoid giving them the contact lens, because these are the athletes, these are the sportsmen. We should not be taking much of the risk on those conditions. But of course, we can motivate them to care and maintain their lenses. We can motivate them to wear their lenses. Okay, so even the various options like a disposable lenses that can be given to those conditions who has a little hectic lifestyle or the schedules. In those conditions, I mean, these lenses again are disposable, or daily disposable lenses can be an option. But again, a care and maintenance is, again, some amount of care and maintenance is required. For fitting any contact lenses, we need to do some basics assessment or the examination. One is a thorough case history. This is important because this will give us the interest of the patients. This will also give us the interest of the sportsmen, why they want to use, when they want to use, what is their expectations with the contact lenses. This will also help us to know about whether they had any previous history of contact lenses, if they were using, I mean, what was the situation, if they are dropout, I mean, patient. So we need to understand why they didn't, I mean, why they are not using, or why they dropped out of the contact lenses. So these all things can be corrected and can be dispensed the lenses, and we can further enhance their performances. Also, we can get the support from the slit lamp biomicroscopy. Slit lamp will give us the detail of the eye ocular features, whether their eye are suitable or fit for the contact lenses or not. Keratometry and the topography will guide us for the optimum correction of the contact lenses. We can choose the right base curve or right dimension of the contact lens for that particular eye. Refractions has to be very accurate. Contrast sensitivity, fusion, and the color vision are the additional tests that we should be doing, because we already discussed that different sports demands different from the eye care practitioners. So we need to see that how we can enhance their color contrast sensitivity, how can make their fusion, or how we can assess their fusion, how any signs of separation or the diplopia should be ruled out, or even the contact lens should not be creating any problem to these part of the eye. Even the color vision should be tested. So I have a poll. I mean, let's see. I mean, in contact lens, do you think that contact lens can be useful for the in the color deficient athletes?
Majority, 70% of them think that yes, they may be useful. About 25% think no, and a couple of them are unsure about this.
Thank you. Yeah, it was a good observation. So majority of people or the audience believe or thinks that this contact lens can be useful in the color deficient patient. Yes, some of the contact lenses like X-chrome, chromogen, some other lenses enhances their color perception by changing the wavelength of the light. So it can be beneficial in some of the color deficient patient. So but one thing to remember, that these contact lenses are not going to treat the color deficiency or manage the color, treat the color blindness. This is just to enhance their color perception. So this can be beneficial in some of the sports where it is allowed to use the this color contact lens for the color vision. Now let's move ahead. How we can fit the appropriate contact lenses. So whenever we are fitting contact lens, it should be very custom, or it should be tailor-made kind of fitting. Any specific demands or the visual demands of these athletes should be made. So we need to understand that if they has any glare issues, if they have any color contrast issues, that needs to be taken care, that needs to be controlled with the contact lenses. Okay, or even vice versa. Our contact lens should not be creating a problem to their performances. Before going ahead, let's understand what various challenges that these sportsmen or these athletes usually face, or what challenges uh, can be seen with the contact lenses when they are using, because the nature of the sports are very different. The some sports may have the environmental challenges. So when we are giving our lenses, or when we are fitting the lenses for these people who are engaged in such sports, may face some of the problems because of the environment. You can clearly understand that swimming will swimmers, or the people who are more into the swimming, will be largely dealing with the water. They may also experience a glaze from the surface. The people who is into the wind surfing, or any water surfing, they again, the wind or air or the water can be a issues. Bicycling, dust, air. Similarly, so all these sports may have some amount of some different kinds of environmental challenges. So our contact lens may also experience some problem because of this environmental issues. So we need to deal with these all problems. Some are there are certain sports which demands a high stability upon the impact, or may have a, so for example, football, wrestling, boxing, karate, gymnastics, and the basketballs, and there can be some more sports also. These sports are played with the high impact. So there is, if somebody is fitting the lenses, we should be very careful that this lenses should remain stable onto the eye. They should not pop out of the eye. They should again, in the all these extreme situation, they should remain onto the eye. They should not be centered from the eye. So the our selection of the lenses should be based on the stability. Now let's understand further onto this. So we have we know that there are the various kind of contact lenses, various categories of contact lenses. Broadly, we can categorize as a soft as well as the or the GP. So soft, uh, and both these lenses fitting criteria, or both these performance of both these lenses are slightly different. So in this, if you see that the RGP lens may be disrupted, especially in the high impact sports, or maybe dust can be trapped beneath the lenses, may cause the reflex tearings and can obstruct the vision. So RGP may not be a good option in some of the sports where dust is the issue, where I mean, pollutions or the pollutants is the issue, where high impact sports are being played. So in that conditions, what do you think that situation can be, or what contact lens can be given? So in that conditions, if we at all is required to give the GP lenses, so we can give that the large diameter RGP lenses or the scleral lenses, or patient can be shifted to the soft contact lenses. In certain sports where there is a risk of the lens loss or displacement is more, in that conditions also, similarly the large diameter lenses can be given. Again, the scleral lens can be an option, and even the soft contact lens can also be given, because these two lenses usually remains on the eye, and they are more stable onto the eye compared to the RGP lens, which are slightly smaller than the cornea, and they have a more movement or less stability onto the eye. If in any sports, the risk of the lens dryness, dehydrations, or patients may experiencing lens awareness or intermittent fogging vision, in that condition, then we need to give a lenses which are less prone for the dry eye or the dryness. So those lenses could be, even if it's a soft lens, it should be opted as a thicker and the low water content lenses, because the risk of evaporation with these lenses, or with this lens, will be less compared to the high water content lenses. So the choice of the lenses we should be given based on that. So so we saw that that the various options in the soft as well as GP, gas permeable, are available with us for the various sports. Only thing is, we need to understand the dynamics of the sports, and we need to understand that in which situation that athletes are going to play their sports. Again, few things to remember that our role is not only giving a right lenses, it's also about giving a right corrections. Many a times patients demand some visual acuity, so we need to give a, we need to maximize, or we need to a visual acuity which is appropriate to their sport. We should be correcting even a smallest amount of the anisometropia or the astigmatism. We should not be directly focusing on the spherical equivalent, or thinking on the other options. There are the lenses available with us in the soft and the RGP, which can correct even the smallest amount of the astigmatism or the cylindrical power. Our contact lens should maintain a good corneal physiology or the ocular physiology. In that conditions, try to give a disposable on, if preferred, a daily disposable lenses. One should avoid giving any extended wear lenses at any situation. We can understand that these athletes will have a very hectic, or will have a very busy schedules. Even in that conditions also, a disposable or care maintenance is required. At no point we should dispense a extended wear contact lenses. Few more tips to know that the soft contact lens is ideal for the part-time wearer. Why is it ideal for part-time wearer? Because these part-time wearers may often forget to clean, maintain, manage their lenses, because they are not regular with the contact lenses. So in that conditions, daily disposable will be the ideal and the safest option. We discussed that there are the color differentiating lenses, or the lenses for the color deficient, which can be useful for various athletes. We should also be should have an option or the choice of the tinted lenses, especially in the adverse situation or the conditions when patients may or may not wear the sunglasses. Also, we need to see that if, because of the high intense concentration, if the patient has a poor blinking frequency, in that conditions, lubricating drop or reweighting eye drops can be given, can be used by the athletes. So these all things can further enhance the performance of the contact lenses. So right kind of contact lens selections is very, very important for better performance and for the successful contact lens practice in the sports. So we saw that disposable lenses is important, especially the daily disposable, because it eliminates the problems of the deposits. Because the moment the deposits will occur, patient will change their lenses. So that is why disposable, we should be focusing on the disposable lenses more. It also maintains the visual acuity, comfort, and the eye health, because these, especially these lenses, are more stable onto the eye. So the popping out of the from the eye, or the risk involved because of the breakage of the lenses, are very, very minimum with these lenses. So these disposable, especially the daily disposable lenses, offers a very convenient contact lens wearing options for many of these athletes, even during their busiest schedules. And and this can, the follow-up or the care and maintenance can be somehow minimized when they're using a daily disposable lenses. But we should remember that follow-up and the care and maintenance is still one part that we had to take care, or we need to follow that. When we are practicing contact lens in the sports, so there could be a few benefits to the eye care practitioners. One benefit is that whenever you are giving them, you give them spare lenses, or if they are using a daily disposable lenses, so what will happen, every time they will have a new lenses to wear. So before every game, they will have a fresh lens to be used. Again, the athlete should be free from any kind of worry for the care and maintenance, maintaining, managing the lenses, carrying the lens case, carrying the solutions. So these all things can be, beneficial to the athletes. Also, it also enhances the compliances, because they are regularly using the lenses, they are regularly replacing their lenses. And also for the eye care practitioners, it is beneficial because patient will take in the bulk, and this eyesight, as well as the hygiene, as well as the risk of infection are less. So that is all, that will also give a confidence and the benefits to the eye care practitioners, and your practice will fulfill. Let's go and understand much in detail about the uh, in certain sports, how and what should be taking care during the water sports. So we all know that water sports is a sports where the various risks are involved. So one should be avoiding giving the RGP lenses, because as we discussed, the RGPs are smaller in size. They usually floats onto the cornea, so there is high chances that they may dislocate from the ocular surface. They may float from the out of the eye. So therefore, we should be avoiding giving the small diameter GP lenses. If required to give gas permeable lenses for any conditions like astigmatism or keratoconus, we can fit with the large diameter lenses. Also, scleral lens can be given. If somebody is using the soft lenses, we should understand that because of the difference in the osmotic concentration of the water, the lens may become steep, or the wrinkling of the lens can is usually seen because of the nature of the water. In that conditions, to avoid the dryness, to avoid the steepening of the lenses, we can give the thicker lenses. Okay. Also, immediately after the sports, the sportsmen or the athletes should discard the lenses, or they should clean or disinfect the lenses properly. So these are few things that we need to take care when we are dealing with the sportsmen who are into the water sports. Otherwise, the problem of the infection is quite high. There's a high risk of the waterborne acanthamoeba infection on the cornea, and as practitioners, we don't want uh, to see that in our patient. So therefore, the care and maintenance is very important. Disinfection is very important. Okay. And the safest is to give the daily disposable lenses or disposable lenses. And if possible, if we can avoid giving the contact lens, that is more good. And even when they are using the contact lens, they should be using a protective glasses, swimming goggles, to further protect their eyes from any kind of infection. And give their spare lenses to your patients, because we know that there are so many things will be happening because of the water. So you don't want an infected lens, or they may have to discard their lenses. In that condition, the spare lenses can be used. So these are a few things for the water sports. But there are certain sports which are very dynamic in nature. So for these dynamic sports, the risk and the problems are different. So we need to address, and we need to give our contact lens in such a way that this lens can perform even in the extreme situation, extreme position of the gaze or the body orientations. These lenses should have a minimum movement upon the blinking. Many a times, the spectacles or contact lens are contraindicated in these sports. So therefore, the contact lens becomes a very, very vital correction method for the sports who are, the sportsmen who played a dynamic sport. But if you are dispensing the lenses, if you are giving the lenses to these people, please try to give a lens or consider a lens which has a properties of the UV blocker, or the lenses which is again very, very stable onto the eye. So those lenses could be again the soft contact lens and the mini scleral lens, or the corneal scleral lenses. Means any lens which is more stable onto the eye, doesn't move on the blinking or the extreme gaze of the eye or the body positions. Some sports are considered as a risk sports. So these sports may have extreme body contact. These sports may be played with the smaller, fast-moving objects. In that conditions, we should avoid giving the RGP lenses. Sometimes the spectacles can also be a source of ocular injuries. So we need to give, if at all required, to give a spectacles or the glasses. It should be very durable. It should not break onto the eye or when they are onto the ground. Recommend the eye protection even on the contact lenses because they may get injury because of that. But again, it depends on the nature of the sports whether these protective gears or the glasses are allowed or not. If allowed, one should encourage using the eye protections. Our lens should have a good centration, stability, and should have a minimum movement. So now by this time you can again will be able to guess that the choice of the lenses can again be the soft contact lens and the mini scleral or the scleral lenses. Okay. Now there could be some sports which are played indoor. There are some sports which are played in conditions which may create a dry eye or the may be high prone to the dry eye. These sports may also reduces the contrast sensitivity because of the nature of the surroundings or the environment, because of the different lighting conditions. Patient or persons may have a poor contrast, may experience some amount of glares. So in that conditions, especially when the patients playing sports which is indoor and they are using the contact lens, we know that especially in the soft contact lens uh, are which are more prone to create a dryness or the dry eye. So if at all we require to give a contact lenses, so can be given, these people can be given with the lubricating eye drops or the artificial eye tears. Also, recommend giving a disposable lenses and eye protections, or some options can be given to improve their glares and the reduce the or enhance their contrast sensitivity. So by this time we have come to know that out of all the contact lens options, RGP contact lens in the sports uh, should be avoided, especially in the dynamic sports, high risk sports, and the contact sports. Though they have a very excellent, provides a good and excellent visual acuity, but still it should be avoided because they may not perform well or they may not go well with these sports. Okay, so what is our preference? The preference is to give a lens which has a large diameter, because large diameter lens will give a more stability and less movement. The large diameter lens will have a large optic zone, so even the sports which are played in the low lighting conditions, uh, or when the pupil is fully dilated, in that conditions also the visual acuity or the risk of the glares are very minimum. One should also be can opt to fit a slightly steep lenses, especially where you require a good stability. But you should understand that it should not be compromising the uh, I mean ocular performance or the orientation of the eye. Okay, it should not be too tight or too steep that it should creating issues or the uh, tear exchange onto the eye. And always dispense a spare lenses to the sportsmen and the athletes. So these are few of the preferences or the consideration we should uh, remember when we are dispensing the lenses. So contact lens in the sports category, scleral lens is a very ideal options because they are large in diameter. They are again in the GP materials, so high decay lenses can be given to these people. and usually they do not get lost or decenter out of the eyes, so therefore they are ideal for almost all kind of sports. So soft as well as clear lens could be a good option and good choice for the various sports. But what if your patients or a person doesn't want any glasses, or the sportsman doesn't are not allowed to wear glass? He doesn't want to manage, or he doesn't want to take all this extra attention of the cleaning, maintaining the lenses, removal of the lenses, putting the lens before their matches, because nobody wants, or many of the athletes doesn't want to touch their eye, because the eye could be a very crucial in their sports. And also the risks involved in the surgeries, they don't want to go under the lasers or the knife. So what options do we have as an eye care practitioners? Yes, there could be a various options, or one vital options that we have is the corneal reshaping, which is the orthokeratology lenses. So one option and a good option that we can look for the athletes, that we can see for the sportsmen, could be orthokeratology. These lenses are usually fit or put onto the eye, onto the cornea, when patient is uh, under sleep or when they are sleeping. So overnight, these lenses usually adjust or reshapes the cornea, and when they are awake, or even after removal of the lenses, the cornea, because of the reshaping of the cornea, they will have the correction whatever it was meant for. So patient will be able to see the things clearly, will be able to manage their sports without contact lenses, without spectacles during the daytime or during the sports time. So this is one of the good options that we should, or we can opt in the sportsman, because even with the orthokeratology lenses, it provides a clear unaided vision during their activities. There is no risk of irritations of the contact lenses during the allergic situation or the climates, because this has been also seen that these athletes or the sportsmen may go to the different geographical situation and conditions, and some conditions can be highly prone to the allergic, or they may not be able to use the contact lenses. So in that conditions, if they are using orthokeratology lenses, so that will reshape the cornea. In the daytime, they don't have to put anything onto the eye. So that's the safest way, because they are not using the lenses in the daytime. Also, there is a no risk of the dry eye due to the contact lens, especially in the sports where high concentration is required, in the sports where which are played with the less humid situation. Also, patient do not have to bring the extra or the contact lenses or the contact lens solutions in the practice, or they have to put the lenses just before the the matches. Also, the risk of these surgeries can be minimized, or it can be avoided, or probably they can also can delay their surgeries. So this orthokeratology provides a more of the stable vision, even in the all the extreme position, because there is nothing onto the no glasses, no contact lenses. So of all the options that we have seen, we can clearly see that the contact lens can be good and the ideal options for the sportsmen in the various sports categories. Soft uh, RGP, scleral, as well as the orthokeratology lenses are the options that we should be seeing. There are certain limitations and the problems that we have to see, we have to understand based on the nature and the of the sports, and we can dispense based on that. So if we are doing that, our practice will fulfill. But again, if you are giving all these and doing these all things, even one important thing is very important. One is the compliance from the patients, and the second is the stress, giving the stress on the care and maintenance of the lenses. No matter how good lenses you are giving, no matter how expensive or how good your practice is. If you are not maintaining, or if you are not uh, I mean uh, I mean taking care of the care and maintenance of the lenses, the risk will be very high, and the performance and the success will be very, very minimum. So try to emphasize on the care system. Always see that these athletes are very may have a very busy day-to-day life. So our care system should not be very complicated. Okay, so emphasize on the personal hygiene and the appropriate lens handling, and please understand that we should not be compromising on the follow-up care. If at all not possible for them to come to your clinic, you should give some options closer by or nearby to them, so that at least they can go for the regular follow-up and follow-up of their lenses. So these are few things that I had to discuss on the uh, contact lens and the sports. Thank you.
Okay, great. So thank you so much, Dr. Noor, for that very, very comprehensive talk. I think it's important to know and understand. And as you took us through the options for different sports and all of that, it's really important for us to understand the last point which you made. I would come to the last point, is the emphasis on aftercare and making sure the compliance is maintained. So, you can give a best lens in the world, but then if compliance is not maintained, that would affect the practice as well as the performance of the athlete as well, right?
True.
One question which comes up to my mind is, what has been the major amount of sports athletes which you have fitted, and what was the choice of lens which you had?
So usually, so usually I have fitted not much, but I have fitted few of the cricketers. So usually I practice in the Punjab, Ludhiana. So the sports like football or the cricket are played much. So usually the college or the university students who are more inclined in the sports, so I have fitted to them. So we can understand that the nature of these sports, especially the players or the people who are more into the football. So we need to give lenses which is stable onto the eye. We also need to understand that the risk of dryness is quite high. So we should be there is two way. Either we should minimize the duration of the contact lens wear to reduce the risk of the perforation or the dryness, or they should remove their lenses immediately after the uses. So I had given the soft lenses to both the athletes. So I think very much they might be happy because they had come for only once.
Okay, great. Okay. So, the question is because as I think you mentioned in the presentation as well, it varies according to the sports and it varies according to the requirement as well. So that is something which is a good takeaway, that, it's not just soft contact lenses every time. You have so many options, and orthokeratology being the one which you also briefed us, it could be very essential for us to consider those options and help our patients. Okay. Probably not directly related to the talk, but any age considerations or restrictions for using Ortho-K for kids who want to play sports? Have you some experience on that?
I would not say, is there any age restrictions? If they are able to manage, or somebody is able to manage their lenses, I think that can be given. So that could be ideal options for almost any ages, any age, whether it's for the myopia control, or maybe because of the management of the myopia, or maybe because of the sports. It can be given. I think somebody should, if the children is not able to manage, or somebody else should be able to take care for them.
That's great. Okay. And one more question regarding the orthokeratology is, would it be possible for us to give a soft contact lens if there is a residual power during active sports time? So let's say they wear it overnight and there is some residual power which they need to see crisp and clear. Is it recommended to give them a soft lens to wear during active sports?
I would say yes, if it at all required to give, but again, the benefits of the ortho K will be again minimized. So if we are opting a lens, which sportsman doesn't want any lenses or anything onto the eye, and they have opted for the orthokeratological lenses. So I think somewhere something will be compromised. But if we need to give a lenses which has some residual power, or we need to further enhance their quality of vision, of course we have to, or we should be looking this option also.
Great. Okay. Yeah. So you should make sure that the athlete enjoys vision, and thereby the performance improves. So yes, I think very rightly said. If you plan to give soft lens as an active sports time, is kind of not reaching to the optimum ortho fit, but let's say it's required to help them to see much sharper and clear. There is no harm, in doing that. Great. And one question about the fitting. So usually you tend to leave the fitting slightly tighter in most of the athletes, or towards the looser side. Is there any preference on the fitting?
We need to see the nature of the sports. Some sports demands a high stability, good stability. So in that conditions, we may go slightly ideal to steeper situation. Some sports, especially in the sports, water. So in that, if somebody is onto the water, maybe because of the chlorine and other particles present onto the water, they may usually tighten the lenses over a period of time after some times. So because of that, slightly a flatter lens can be chosen and given, but we should understand that it's a slight. The lens should not be that flatter that it is decentering out of the eye. So slightly on the flatter side can be given in the water sports.
Okay, so water sports slightly looser, and probably contact sports and acceleration sports where kids, athletes are jumping and motion. So that one slightly tighter, slightly steeper. Right. Great. And one last question before we end the session is also important, and I think you did a stress point on it, is follow-ups. So is there a difference in terms of follow-ups or aftercare if you are having to fit an athlete versus a normal refractive patient?
I don't think so. There will be a difference. Both requires a care and maintenance.
Okay.
So the risk of the infections is equal whether it's athletes or it's a normal. So care and maintenance has to be standardized. It has to be dealt with accuracy.
Yeah. So you would want to see them after 1 week, 2 weeks, 1 month, routinely, as you would see a non-athlete, basically, right?
Yeah.
Great. Okay. So thank you. Thank you, Dr. Noor, for that wonderful presentation, and answering the questions and giving us your insights about how contact lenses can be used in sports. Thank you so much for sharing the time with us.
Thank you everyone. Thank you for sparing your Sunday to enjoy this session. Thanks Fakhruddin. Thanks entire team.
We do have session planned next weekend. Those who are celebrating Christmas, Merry Christmas, take care, enjoy the festive season, and I would wish to see you all next weekend for another session. Take care, be safe, and bye-bye.